Our ongoing series, What's Working, looks at innovations that are paying off. In Durham, North Carolina, all parents are offered a helping hand in their first few months of their children's lives. 30,000 families have welcomed registered nurses into their homes as part of the Family Connects program. Our Dr. Tara Narula shows us how it's working to help lower healthcare costs and raise parent confidence. Tara, good morning. This seems like one of the most brilliant ideas I've ever heard. I love it.
Such a great initiative, public health-wise. The first year of life is crucial to the developing brain, but parental instincts are not always enough to take on the challenges of caring for a newborn. Sometimes it takes a village to support, listen, and embrace the entire family.
Hi, good to see you. Come on in.
Good to see you again. How are you doing?
I'm good. How are you?
Hi. Oh, hi, Jenny.
Nurse Jenny Jensen is delivering some extra care.
You can just hold her, and I'm going to give her a little listen.
Right to 5-month-old Cora's doorstep.
He's going to stretch you out.
She's tracking pounds and inches along with the parents' stress levels.
We have had our challenges, ups and downs.
Can you tell me more about what was going on?
This past Sunday, I just felt sad.
Before they leave the hospital, new parents like Zawadi and Damon Walker are offered free home checkups.
I think we both had the same fear about being left to our own devices with this whole new life.
The first visit comes a few weeks after birth.
Was she sleeping too much? Also with the breastfeeding, is she getting enough nutrients?
In addition to organizing feeding and sleeping schedules, the nurses address safety conditions in the home, working with the pediatrician if there are health concerns. But some of their most meaningful advice covers work-life balance and personal relationships.
She took time to ask about you and you together.
Yes. She gave us tips, told us not to be afraid to reach out to our support so that we can have some moments for ourselves.
It's a very personal thing to bring somebody into your home. Just about everyone in your life has an opinion about how best to care for that baby. We're able to provide evidence-based information for families that they can trust.
The nurses help parents find daycare, government benefits, even the safest car seat for their baby. Between visits, nurses stay in touch with their families by text and phone.
Just wanted to call and check in and see how your weekend was with baby Harper.
Fielding questions that may not surface at the doctor's office.
Pediatricians are wonderful professionals, but they simply cannot have 2 hours to come into your home, and that's what our nurses are able to do.
Duke University's Kenneth Dodge developed Family Connects.
Parents are very anxious. Maybe the system worked when mothers stayed at home full-time, but that's simply not happening very often today.
And the program is paying off. For every dollar spent, it's estimated $3 in healthcare costs are saved. Emergency visits for babies in Family Connects were cut in half.
Parenting is more positive. And then in the long run, we found important outcomes such as lower child abuse rates and lower health care costs for emergency room visits for injuries and illnesses.
Even experienced parents are embracing the help.
Hey, would you like to get a book that I can read to your brother?
3 years ago, Megan Dunphy-Daly gave birth to her daughter in Washington, D.C.
Would you like some avocado?
After the birth of son Caden in Durham last May, Megan thought she and husband Jason still had a few things to learn from an expert.
She watched me nurse him and provided advice on that. It was much easier than bundling everybody up and taking my older daughter to the doctors with us.
Hi, baby boy.
If I could have had this with my daughter, I would have been a much more confident first-time parent.
He loves you.
The program's impact is being felt nationwide. 16 communities have sent nurses to be trained in Durham, and 14 more sites are being added soon.
So who's paying for it?
So there is government funding, but also there's funding from the state level, the community level, profit organizations, and nonprofits. So it's a group effort, but a huge public health impact from something that's so simple.
I absolutely love this idea. Now, you pointed out that it lowers healthcare costs and emergency room visits. Explain how that works.
So Dr. Dodge gave a great example, which is, for example, if a mother sees a rash on her child at 2 in the morning, in the past she might have taken them to the emergency room. Now, if she's connected with a grandmother down the street in the program, she can call her up and maybe maybe have her tell her, you know what, that's not so big a deal. You don't have to go to the hospital. Also, they teach families safe practices about not putting your baby on a high up area where they could roll off, making sure they have a crib in the home. So things like that where they avoid injuries and accidents.
Are there any restrictions at all on what families can participate?
There's not, and this was a really important point, is that it applies to families of every socioeconomic background, every demographic background, because as they say, every family has needs.
Yeah.
Every family needs support. And this is something we don't ask for support, but we are evolutionarily, biologically based human beings that need support. That's how we grow.
I took care of my sister growing up, and even when I became a mother, I thought there are so many things that nobody taught me that I didn't know about. Everybody needs help.
Yes, and he also makes the point that, look, we talk about children being the future of our economy, of our society, but they're human beings now. They're part of our community now.
That's right.
And we need to invest in them now, as we would with anybody else.
And they're more demanding than ever at the beginning.
Right now. Just my luck, it comes 16 years too late.
All right. Tara, thanks. And for more on Family Connects and a step-by-step guide for soothing a fussy baby, go to our website, cbsthismorning.com.